Assalamu alaikum. I am Aqsa Ali with the course titled Nutrition, Diet Therapy and Prevention. Today, the topic which we are covering is weight management. This is the very first topic we are going to discuss in nutrition and diet therapy because it is most hot topic among our community and a major issue faced by the community. So, what is weight management? First, we need to understand some basic terms regarding weight management. The components of body which are interfere, the hormones which interfere regarding weight management. So, what is body weight? Body weight is a sum of bones, muscle, organs, and body fluids and adipose tissues. So basically, the weight of body is subdivided into two components, fat mass and fat-free mass. Now, what is fat mass? Fat mass is the fat from all body sources, including the brain, skeleton, and adipose tissue, whereas the fat-free mass includes water, protein, and mineral components. As we can see in this image, approximately 76% of our body is fat-free mass and 24% of our body is fat mass. The percentage of fat among female is more than male. Now, what is lean body mass? Lean body mass is also known as the muscle mass. It is higher in men than female, and it increases with the exercise and decrease by age. As we get older, lean body mass decreases, and if any person is involved in any type of exercise and activity, he will be having more lean body mass. Lean body mass is the determinant of resting metabolic weight. It includes skeleton, muscle, water, bone, and present in bone marrow, internal organs, and nerves. Basically, body fat is subdivided into two categories. Number one is essential body fat. Number two is storage fat. Now, what is essential body fat? Essential body fat stores usually in your organs like bone marrow, kidneys, spleen, liver, lung, heart, muscles, and nervous system. The percentage of essential body fat is more in female than male. Approximately, male have 3% of essential body fat, whereas female have 12% in their bodies. Female have more tendency of essential fat is due to the pelvic region and their thigh area and breast area. Now, what is storage fat? Storage fat is act as insulation and protect the organs. Basically, a storage fat is a layer of fat under the skin which protect the organs and protect from trauma. The storage fat considered expendable. Whenever your body needs energy, very first fat which will be used for energy, that will be storage fat. Total body weight is equal to essential fat plus storage fat. The ranges for body weight fat is 8 to 24% for male and 21 to 35% for female. So we can see female have more fat percentages than male, but male have increased tendency of lean body mass than females. Now we are going to discuss the next term, which is adipose tissue. Now, what is adipose tissue? Primarily fat located under the skin, composed of protein and water, and exert influence on body homeostasis, self-regulatory process. So adipose tissues are the lipid droplets storage area. Store fat in quantity of their volume. A cell that synthesizes and stores triglycerides is called adipocyte. So adipose tissue is further divided into two categories: white adipose tissues and brown adipose tissues, WAT and BAT. Now, what is WAT? Basically, white adipose tissues store energy, whereas brown adipose tissue are the key regulator of energy expenditure. So white adipose tissues are repository for triglycerides, serve as the cushion to protect the abdominal organs, and insulator to preserve heat. And their white color is due to carotene. Whereas the brown adipose tissues present mostly in infants and occur in primarily scapular area, involve heat production, and a key regulator of energy expenditure. So, white adipose tissue store energy and brown adipose tissue is a key regulator of energy expenditure. Now, we are going to discuss 2 to 3 terms about adipose tissue, that is hypertrophy, hyperplasia, hyperphagia, hypophagia. Now, what is hyperplasia? Hyperplasia is the increase in tissue size by increase in cell size, whereas the hyperplasia is increase in tissue size by increase in cell size. Hyperplasia, increased number of cells, and hypertrophy is increased number of cell size. Hyperplasia में नंबर ऑफ सेल्स इंक्रीज करते हैं और हाइपरट्रॉफी में सेल साइज इंक्रीज करता है, नंबर्स उतने ही रहते हैं. And the other term I was discussing was hypophagia, period of under-eating, and hyperphagia, period of overeating. When weight is lost due to any reason, cell number size will not decrease, but cell size will decrease. If a person is obese and wanted to reduce weight, so he will reduce cell size, not number of cells. So once the adipocyte cells are developed, their size can be reduced, but their numbers cannot be reduced. Now there are some terms regarding metabolism, metabolic rate. You must have already done this chapter with Ms. Kinza about resting metabolic rate, basal metabolic rate, and activity thermogenesis. So now what is activity thermogenesis? Activity thermogenesis is the energy expended in voluntary activity, the most variable component of energy expenditure. Under normal circumstances, physical activity accounts for 15 to 30% of total energy expenditure. However, all activity counts. Now, what is metabolic rate and voluntary activity. This is also called non-exercise activity. Thermogenesis is the energy expended for all activity that is not sleeping, eating, sports like exercise. It includes going to work, typing, doing yard work, top tapping, even pitching. So means whatever activity you are doing on daily basis, usually called your sedentary lifestyle, is called non-exercise activity thermogenesis. That is your routine. You wake up, you go to school, you go to washroom, you go for walk, you go for cycling, you go for game. So this is your activity. The non-exercise activity thermogenesis is required for your sedentary lifestyle. So physical activity, what is physical activity? Physical activity is a set of period or set of activity you repeat it for some sort of time span. For example, you do some squats, you do some treadmill, you do yoga, you go for walk, brisk walk. So these are your routine works and the energy required for these were called non-exercise activity thermogenesis. There is a list of hormones and physiological factors and regulatory factors you need to understand weight management. So I am using cross for this chapter, weight management. Basically, we will be following cross. I will be sharing this book with you so you can have an idea about this chapter. The table number 12.1 at page number 536 is basically a table for hormones which are have an interference with weight management. So we will be doing it in detail in our next lecture. Here I am going to discuss two hormones. Number one is leptin and number two is ghrelin. So these two hormones are basically involved in weight management. So what is leptin? An adipose cytokine secreted by the adipose tissue that is correlated with the percent of body fat, primarily signaled from energy stores. In obesity, loses the ability to inhibit energy intake or to increase energy expenditure. High concentration of serum leptin is seen in women than men. Observation confirmed that the role of leptin is regulating appetite. So basically, leptin is an appetite regulatory hormone, whereas ghrelin is ghrelin regulate your hunger and stimulate into the stomach. And ghrelin levels are highest in lean individuals than in obese. Increased levels are seen in people who are dieting, and stress levels are noted after gastric bypass. Many other factors like genetic, family factors, and family history also involved in weight management. For example, peer pressure. If your family have eating habits of late dining, so you will be having this habit in you. So family patterns, family religion, family eating habits, family trends, these are all the factors which affect your weight. Besides that, physiological factors are also the part of this, The amount of body fat the person carries is related to the number of size of fat cells in the body. Critical period of becoming obese occur during early growth periods when cells are multiplying rapidly during childhood and adolescence. Metabolic rate, physical activity, and lean muscle mass are major physiological factors for determining individual fat storage. These three main factors: basal metabolic rate, physical activity, and lean body mass, lean muscle mass. So basal metabolic rate is the energy required for functioning of your body organs. The energy required for at rest. At rest, the body needs energy is called basic metabolic rate. What is physical activity? You a set of period of activity and you require energy for that. And lean body mass is a part of your muscles. So these factors are interfering with the fat storage. If you are having a more physical activity, so you will be having less fat storage. And if you have increased metabolic rate, you will be having increased requirement for energy. So these are the factors, like if you're in your family is forcing you and have a pressure of being ideal, so you will be having strict dieting. So these are the factors. You follow some kind of strict diet patterns like Atkins diets, like yo-yo diets, like you must be hear about keto diet. So while having your pressure, you will be following these diet patterns. We will be discussing about these diet patterns in detail. So further, weight management is divided into two categories, 2 to 3 categories. We have three type of patients you have come up with. Number one is obesity. Number one is normal weight. Number three is underweight, malnourishment. So while discussing about weight, we will be focusing on obesity and malnourishment management. So in our next lecture, we will be discussing about obesity and underweight weight management. So take care.